Good morning, students. Today's topic is from the same unit, that is altered immune responses, and today's topic is rheumatoid arthritis. So what is actually the word arthritis means? It is inflammation of the joints. Now let's see what is rheumatoid arthritis. Let's see the introduction. Rheumatoid arthritis is an autoimmune disorder in which immune system identifies the synovial membrane as foreign and begin attacking it. So in this rheumatoid arthritis, that is it is an autoimmune disorder. That means autoimmune means automatically generated. That is body itself is producing this disorder. And in this, what happens? The body identifies the synovial membrane. The synovial membrane is nothing but it is present between the joints, and the body identify it as a foreign material. That means it identify it as a substance outside the body, and so it begins attacking it. Then see this diagram. In this, two diagrams are present. One is healthy joint and one is rheumatoid arthritis. Let's see the definition. Rheumatoid arthritis is a systematic inflammatory disorder of connective tissue characterized by chronicity, remissions and exacerbations. Then second definition, rheumatoid arthritis is a chronic inflammatory disorder that may affect many tissues and organs but mainly attacks the joints, producing an inflammatory synovitis. So as I said, it is an autoimmune disorder, and in this situation the body itself attacks the body own system, that is mainly the synovial membrane which is present between the joints. Now let's see the etiology. The main etiology is unknown, that is actual cause is unknown, that why the body is attacking itself again. So this is unknown. Now let's see the risk factors. The risk factors are positive family history, that is from the family members, that is genetic. Then infectious agents such as viruses, bacteria and protozoas. So this infection can also cause arthritis. Then next are gender, that is male and female. Then environmental factors, smoking, vitamin D deficiency, occupational exposure. So these are some risk factors that can also cause rheumatoid arthritis in a human being. Then signs and symptoms. What are the signs and symptoms you are going to notice? Onset of symptom is acute, that is it will be for a short duration whenever it will occur for the first time. Then fatigue, joint pain, joint tenderness, joint swelling, erythema, then joint stiffness, joint warmth, joint loss of joint range of motion, joint deformity, both sides of body is affected, anorexia, then weight loss, persistent anemia, rheumatoid nodules. These are some signs and symptoms you are going to notice in a patient with rheumatoid arthritis. It is mainly associated with the joints, that is joints inflammation. Let's see the diagnostic procedures you are going to carry out. So first diagnostic procedures you are going to carry is X-ray. In X-ray you are going to clearly visualize the part that what is actually happened, and you can see that osteoporosis in the joints, that is bones will start having erosions. Then next is magnetic resonance imaging. Then next is blood test. In blood test you will go for rheumatoid factor, that is you will be going for this factor to be tested in the blood. Then it will be seropositive. Then you will go for ESR rate. In the ESR rate will be increased. Then C-reactive protein. Then next is complete blood count. In that you will be seeing that anemia will be, the patient will be anemic. WBC count will be elevated, will show that the inflammation is present. Then immunoglobulin you will be checking, that is IgM and IgG. So increase in immunoglobulin will also show the autoimmune responses in a patient. Then synovial membrane biopsy, you will be taking synovial membrane and you will be testing it. Then the next is synovial fluid aspirate. You will be aspirating the synovial fluid from the middle of the joints. Then you will go for the direct arthroscopy. In a direct arthroscopy you will be seeing the irregularities and this degenerations of the joints. Then the next is management. In management the goal is decreasing inflammation of the joint before bony ankylosis occurs. relieving discomfort, preventing or correcting deformities, and maintaining or restoring functions of the affected structures. So this is your main goal. Then management, in that first is medical management, that is you have to treat it with the drugs. So first is salicylate, that is aspirin, or NSAIDs, diclofenac. This is used for reducing the pain. Then you will be giving corticosteroids for reducing the inflammation. In this corticosteroids you will be mainly giving the prednisone or prednisolone. Then next is topical analgesics, that is capsaicin. Then immunosuppressives to reduce the IgG and IgM. In that you will be giving azithromycin, methotrexate. Then you will be giving therapeutic management, that is hot and cold applications to reduce the pain. Then dietary management, you will be allowing the patient to have more fruits and vegetables that will help the patient to gain some vitamin D. Then we will go for the surgical management, in that it is arthroplasty, tendon repair, synovectomy, and arthrodesis. And arthroplasty, in a total joint replacement you will be doing. Then tendon repair means you will be repairing the tendon. Then synovectomy, the procedure involves removal of the synovium if it is inflamed and causing pain. So if there is inflammation, so much inflammation, then you will be removing the synovium. Then arthrodesis, surgeon will fuse a bone or joint to decrease pain and realign or stabilize the joint. So when there is more pain and the person is not able to walk, so the surgeon will be introducing a bone. This is called arthrodesis. Then you will be coming for the nursing diagnosis. So it will be according to the main priority, that is first the person will be having pain. So it will be acute and chronic pain related to inflammation and increased disease activity, tissue damage, fatigue, or lower tolerance level. Then for this nursing intervention will be comfort measures. You will be ensuring to have a great comfort measures. Then administer anti-inflammatory analgesics and slow acting anti-rheumatic medications. Then encourage verbalization of feelings about pain. Teach pathophysiology of pain and rheumatic diseases. Assist for subjective changes in pain. So this nursing interventions you are planning, and you will be planning on the patient according to his needs. Then next see the second nursing diagnosis, that is fatigue related to increased disease activity, pain, inadequate sleep or rest, deconditioning, inadequate nutrition, and emotional stress. Then nursing intervention will be describe comfort measures while providing them, develop and encourage a sleep routine, explain importance of rest for relieving emotional stress, identify physical and emotional factors. And the next is facilitate development of appropriate activity rest schedule, encourage adherence to the treatment program, encourage adequate nutrition. So according to the nursing diagnosis, these interventions you can plan according to your work criteria. Then the third nursing diagnosis is impaired physical immobility related to decreased range of motion, muscle weakness, pain of movement, limited endurance, lack of improper ambulatory devices. So there is a inflammation in the joint, so for sure the patient will be having impaired physical mobility. For that, interventions can be, you can provide supporting advices, then encourage verbalization regarding limitations in mobility, assess need for occupational physical therapeutic consultation, encourage independence in mobility, and assist as needed. The next is self-care deficit related to contractures, fatigue, or loss of motion. For this, nursing interventions can be assist patient to identify self-care deficits, identify factors that interfere with ability to perform self-care activities, then develop a plan based on the patient's priorities on how to establish and achieve goals to meet self-care needs. So these are the interventions you will be planning. Then you can go for the next nursing diagnosis. The next nursing diagnosis is disturbed body image related to physical and psychological changes and dependency imposed by chronic illness. Then next is ineffective coping related to actual or perceived lifestyle or role changes. For these nursing interventions are help patient identify elements of control over disease symptoms and treatment, encourage patient verbalization of feeling, perception, and fears. Then identify areas of life affected by the disease, develop plan of managing symptoms, and enlisting support of family and friends to promote daily functions. So this was the topic for today's class. In today's class, we have discussed the definition of rheumatoid arthritis, that is, it is an autoimmune disorder in which the synovial fluid is identified as a foreign membrane and body starts attacking it. Then we have seen the etiology, which is unknown, that is idiopathic. And we have seen the risk factors, signs and symptoms. Then diagnostic procedures. In management, we have seen the medical management, surgical management, and nursing management. Thank you to all of you for the today's class.